Are cortisone injections a scam? The research is showing that it does not work. So why are so many doctors still prescribing it? Hi, I'm Dr. Ong, Podiatrist from Australia. Having helped thousands of patients with plantar fasciitis over the years, I've seen how poor advice from doctors has led to poorer outcomes, which is why I'm here to provide you with accurate research-backed information to allow you to heal more effectively. By the end of this video, you know everything about cortisone injections, so you know if this is the right treatment for you and your plantar fasciitis. I'll be sharing about the benefits and the risk, the safety and the efficacy, so stay along until the end of the video. What are cortisone injections and how do they work? Cortisone is a steroid, a powerful anti-inflammatory medication. When injected into an area with inflammation, it can reduce the swelling and pain relatively quickly. This is why doctors often recommend it for painful conditions like bursitis, tendonitis, and yes, plantar fasciitis. The logic is simple. If you have an inflammatory condition, what you do is you utilize an anti-inflammatory medication. In addition to that, cortisone injections are widely administered because it is relatively inexpensive, easy to administer, and as a once-off treatment, it doesn't require a long-term commitment. But as with any treatment, there are two things to consider: the safety and efficacy. Let's look at what the research says. The risk of cortisone injections. Looking at what the research says, here's where things get tricky. Cortisone doesn't just reduce inflammation, it actually weakens tissue. Research has shown some dangerous side effects of cortisone use. The first one is short-term masking of pain. Without feeling the pain in your heel, what you may do is some additional activity, more than you normally would, which would then create additional damage to an area that's already injured. Fat pad atrophy. This means that the natural cushioning underneath your feet thins out over time. This is irreversible, and that also means that you'll get additional pressure underneath your heel over time. Plantar fascia rupture. What a rupture is basically a complete tear in your plantar fascia, and the research has shown a 2.5% chance of getting a rupture with each cortisone injection. What that means is whenever you go for an injection, there is a 1 in 40 chance of completely tearing your plantar fascia. The efficacy of cortisone injection. In this research here, it showed that cortisone injection provided short-term pain relief at 4 weeks, but this pain relief did not persist beyond this time frame. What this means for you is that even if you experience some improvement with your cortisone injection, you shouldn't expect the pain relief effect to persist in the medium to long term. With a real potential for adverse events and only a limited time benefit available with cortisone injections, why are doctors still recommending it? They ultimately believe that it's the perfect solution because the plantar fascia is inflamed. Providing or administering an anti-inflammatory solution seems like the right thing to do. But is that what the research really says about plantar fasciitis? Most people think that plantar fasciitis is caused by inflammation, and it's easy to see why. If you look at the naming of the condition, the presence of the section itis signifies inflammation. Just like bursitis or tendonitis refers to inflammation of the bursa and inflammation of the tendon, many people think that plantar fasciitis naturally means inflammation of the plantar fascia. But research shows that this is actually not true. In a lot of cases when they've scanned the plantar fascia, it doesn't really show inflammation, but rather degeneration. So what this means is that the plantar fascia is not inflamed, it is actually breaking down. Plantar fasciitis is a chronic condition, and what this means is that the condition happens over a prolonged period of time. And at the beginning of the condition, there would be inflammation within the plantar fascia. Because of the repeated microtrauma that the plantar fascia is undergoing, the body responds by producing inflammation to attempt to heal the injured tissue. But over time, the body has to stop the inflammation and that is when the process converts from being inflammatory to degenerative. And oftentimes when people experience pain with the plantar fasciitis, they are typically already in the degenerative state. So is cortisone injection a scam for plantar fasciitis? No, it's not. It does have its place. But having said that, it's very often misapplied. When applied to an inflammatory condition, it can work very well, but as you already know, in many cases of plantar fasciitis, there isn't really an inflammatory component. So not only is it ineffective, it can actually backfire and make your condition worse. So what does this mean for you? If you're thinking about having a cortisone injection, make sure you first consider both the safety and the efficacy of this treatment. Make sure to discuss this with your doctor to see if this is the right treatment for your plantar fasciitis. Have you had a cortisone injection for your plantar fasciitis? How was your experience like? Let us know in the comments down below.